let's talk about something a little awkward, but very real, something men might describe as sperm cramps. Now, medically speaking, sperm can't cramp, but when someone uses this term, they're usually referring to a cramping, aching, or sharp pain in the testicles, groin, lower abdomen, or even the perineum. That's the area between the scrotum and anus. So what causes this kind of pain? Let's break it down. First up, inflammation and infection. The most common culprits are prostatitis and epididymitis. Prostatitis is inflammation of the prostate gland, often causing pelvic pain, painful ejaculation, or urinary issues. Epididymitis, on the other hand, affects the sperm-carrying tube behind the testicle and causes swelling, redness, and intense testicular pain. Both can be caused by bacterial infections or sexually transmitted infections like chlamydia or gonorrhea. Next, pain with ejaculation. Some men experience sharp or cramp-like pain during or after orgasm. This can be due to inflammation or tight pelvic floor muscles, which brings us to the next cause. Pelvic floor dysfunction is more common than you'd think. These muscles can become tight or strained due to stress, injury, or even posture, leading to deep aching testicular pain and urinary symptoms. Then there are structural issues, like a varicocele, which is like a varicose vein in your scrotum, or an inguinal hernia, where tissue pushes through the groin wall, and sometimes pain can come from somewhere else entirely, like a kidney stone. That pain radiates from the back and can reach all the way to the testicles. Here's something important. If you suddenly develop severe, one-sided testicular pain, it could be testicular torsion, a twisting of the spermatic cord that cuts off blood flow. This is a medical emergency. If that ever happens, don't wait. Go to the ER. So, what should you do if you're experiencing this kind of pain? A doctor will usually start by asking about your symptoms, examining your pelvis and testicles, and possibly doing a digital rectal exam to check your prostate. Tests may include urine analysis, STI screening, and a scrotal ultrasound to look for infection, blood flow problems, or other structural causes. Treatment depends on the cause. Antibiotics for infection, NSAIDs for inflammation, pelvic floor physical therapy if muscles are the issue, or surgery if needed. Bottom line, don't ignore persistent pelvic or testicular pain. It might be awkward to talk about, but it's important. If it hurts, get it checked. Thanks for watching, and stay tuned for more men's health topics.